We're here. We're live. Good afternoon, everybody. It's good to see you all. We got this one's a little bit short notice, so I apologize for that. You can all hear me, right? All right, good. Tell your boss, tell everyone, tell whoever is in charge of your work life, you have something very important to do. And that thing is listening to an internet comedian ophthalmologist talk for the next like 30 minutes. Very honestly, you don't really have anything better to do. You really, I mean, maybe you do, but it's this. It should be here. Let's just enjoy this time together. It is 12:45 in the afternoon. I was in surgery this morning, as I am every Wednesday morning. Hi, everybody. It's good to see you all. Surgery went well. I did 10. It was kind of a light day. I did nine cataract surgeries this morning, and I just have a quick little story to tell you all. I made a sometimes fatal mistake, and I'm not talking about for the patient. I'm talking about for me. I made a mistake. I grabbed an instrument off of the scrub tech's table. I grabbed it. She was sitting right there, was doing other stuff, and I needed something, and I just grabbed it. All right. So for all the med students, this is and residents, not something you do. You don't do that. All right. And what she told me is, she said, I don't care how many subscribers you have. All right. You don't take anything off my table. And I was like, okay, you're the boss. I'm sorry. And the reason for that, just so you all know, is because people can get hurt. People can get stabbed. There's knives. There's sharp things. There's scalpels. And so it's a good idea not to do that. I don't know. I don't know what I was thinking, everybody, but I won't let it happen again. All right. So if my scrub tech is working right now, but I'll let her know that I publicly apologized for that egregious error that I made. Hello, everybody. We got people from Canada, from Texas. All right, it's good to see you all. It's been a bit since we did a What the Hell Wednesday. I missed 2 Wednesdays ago. Just had things to do. I don't know what I was doing, but I thought about it. I was like, I'm supposed to be doing a Wednesday live stream, and I didn't get to it. So now 2 weeks later, now it's I try to do this twice a month. All right, and I'm gonna keep trying to do this twice a month because I like connecting with you guys. I like connecting with my audience. And if I don't do it every 2 weeks, I'll at least do it once a month. I promise you that. I probably shouldn't make promises like that, but I will because all of you mean a lot to me. I love the Glock flock here. By the way, we are up over like 470 something thousand subscribers. Amazing. You guys are amazing. Thank you for continuing to watch my videos. They are getting longer. If you've noticed, I am not posting as many short videos, less than a minute. I've got too much to say, I think, and too many facial expressions that take too long, and so I end up with videos that are like 2 to 3 minutes long, and it might actually start getting even longer than that. I don't know. We'll see. Hopefully, you guys don't mind. I assume you like the longer videos, right? YouTube likes the longer videos. TikTok, not so much. My views on TikTok are going down, and that's okay. They're still pretty good. They're not as good as they used to be, and I think it's just a matter of the longer videos. The TikTok audience, they don't have the attention span. It's like it's just like TikTok is made up of like 150 million emergency physicians. That is the level of attention span that we're talking about here. And YouTube's a little bit better. You're not quite a like internal medicine doctor level attention span, but you're more like maybe like a general surgeon or maybe even an anesthesiologist. I don't know, somewhere in the middle. All right, not like the emergencies on one end, internal medicine's on the other. You're somewhere in the middle. And hello, everybody. Oh, it's good. It's good to be here. It's good. It's good to be doing urgent care attention span. That's good. That's the YouTube is an urgent care attention span. You can spend a few extra minutes. You don't have to be constantly stimulated by difficult clinical problems and emergencies and all this stuff. You just kind of like go with the flow. That's emergent. I like that's YouTube. That's right there. I like that. All right. Someone's up. Hi from Morocco. How's it going? And we got here a little note here. Mike R. Thank you, Mike R. Um, get my Scribe Tech a breakfast. I will. I will. You know what? Sometimes, occasionally, I'll buy everyone crumble cookie. Now, if you guys don't, I don't know. I assume they're everywhere in the U.S. But crumble cookie, it's all the rage. Shout out to Crumble Cookie. I'm not sponsored by Crumble. I would love to be sponsored by Crumble Cookie. I just really like those cookies. They're so good. They're so good. Hi. Oh, you guys are from all over the place. I saw Egypt in there. It's amazing. Germany. Awesome. Hi, Denver, Colorado. Everybody. Armenia. Wow. I love seeing everybody. All right. We have a lot of international audience here, and so I want to talk for a little bit here about the match. Oh, hey, look, there's Lady Glockenflecken. She was playing with the dog. You see, we have this little dog here. We have is Milo. Milo, hey Milo, what? He's sleeping. Hey, buddy, let's say hi. He's usually this is his nap time. He could not care less about what I'm doing right now. Does not. He just wants to be in the same room as me. That's all. He's a standard poodle. We rescued Milo. He was in foster care about 6 months ago, and a beautiful dog. Standard poodles. They're so mild mannered. Great family dogs. Super tall, just like me. And we got the same hair. Everybody. We Milo. We have the same hair. Look, the same hair. I'm a little grayer than he is, but we got the same curly hair, and we frequently will take naps together because he's a dog, and I'm an ophthalmologist. That's why. That's really why. And so I don't. Yeah, Milo. I got to work on him with. I'm still training. We're doing a lot. He's still kind of a puppy, basically, and so he doesn't sit well for the camera. So in terms of getting him into videos, it's a little challenging at times. So yeah, I'm working on it. I'm working on it here. All right. So as I mentioned earlier, a lot of international people here who like my videos, watch my videos, which is always surprising to me. It's like it's really cool to hear people from other countries, other parts of the world tell me that everything is the same in medicine everywhere. Like the people are the same, the interactions, the personalities. I think it's so cool. And it's great for my content, right? Because it brings more people in, and I can kind of reach more communities out there, which I love to do. And it's also kind of scary in a way that medicine is like for like the last 100 years, it hasn't changed. The same people do the same things and make the same mistakes and are doing the same things that probably shouldn't be doing, and things that should have been changed a long time ago haven't been changed. And that's partly why I have so many different videos on different topics, because there's a lot of things that are wrong in healthcare, especially in the US and in medicine in general, that sometimes it's helpful to shine a light on that, poke fun at that. Sorry about the boy. I don't know what. There must be someone at the door. I don't know. Chuck Beats. Will you ever make some content of what it's like to chat with non-college people who explain your own job to you? I don't know. Probably not. I don't know. I don't feel like that's too big of a problem. I kind of sometimes stuff like that happens. Just kind of zone it. Just to kind of filter it out. I don't think about it too much. Milo. Does Milo have a John? No, he doesn't. But he could probably use one. Jonathan could probably do some things for Milo. All right, so let's talk about the match. So those of you who are not in the U.S., the match just happened. You've been hearing a lot about it. I've put out a couple of videos about the match. It's probably very confusing to those of you who are not in healthcare trying to understand what on earth is going on. Why are all these people on social media talking about, there's two extremes, right? There's people that matched that are insanely happy, they're thrilled, dream come true, all this stuff. And then you have the other end of the spectrum, people that are dejected, that are incredibly sad and depressed and feel like their world is crashing down on them. And so I just want to address this real quick here. The match, just to give you an overview of what the match is. So, you get into med school, you go through your classes, you figure out what kind of doctor you want to be in med school. I came into med school, I had no idea what kind of doctor I wanted to be. And eventually I found ophthalmology, and then what you do in your final year of med school, you pay a lot of money. You get yourself some of those nice federal student loans that you just keep accumulating throughout the 4 years of med school. You try not to think about it, but it's there, lurking, looming, waiting for you to graduate med school. And so you get yourself a nice loan to pay for all these applications. And the number of applications that people put in to apply to residency just keeps growing and growing every year, which is a problem, I think. But and so people apply to anywhere from like 40 to 150, almost 200 different programs, depending on the different specialty that you're wanting to go into. And then you finish interviewing, and what the student does is you make your match list. You rank the programs you want to go to from your number one all the way to the last one that you interviewed at. And then the programs, they make their match list. They make their list of what, like 100 to 300 people that they interviewed. They rank them all 1 to 300. And then this spooky algorithm that's run by the National Residency Match Program, the NRMP, this very mysterious program that no one really understands, or I'm sure somebody does. Somebody has to understand it. It's like the Jonathan of match programs. It's very mysterious, and it could maybe it's alien technology, maybe it's magic. Who knows? They run this algorithm that matches students to programs, and a lot of people match. The majority of people match to a program, but a lot of people don't match. A lot of students work very hard for years. Imagine joining this graduate program and signing up for at least 4 years of your life, sometimes more, if you do like dual degrees or something, or you take an extra year in med school. Imagine signing up for that in your 20s, right? Your 20s, you're a big portion of your youth. And you also, by the way, pay hundreds of thousands of dollars when you sign up for that, but you have no guarantee that you're actually going to get a job afterwards. That's terrifying, right? Can you imagine? That is absolutely terrifying, because the price of education is going up for reasons nobody knows. I honestly, I can't figure it out. I don't know why tuition is $80,000 per year. It's kind of outrageous. And then having that debt load, but then getting to match day and you don't have a program. You don't match. That is why you get these extremes, from one side of people matching, one side of people not matching. And the most difficult thing, the most frustrating thing, is that these students that are not matching, they are fully capable of doing the job. They are fully capable they have gotten through 4 years of med school. They've taken all the tests. They've passed all the tests. They are going to be doctors, but they don't have the job in the specialty that they're wanting to do. And it's scary, and it's very it's a very difficult thing. And now there's a lot of problems that go into it. You might be asking, why is it like this? Like, what are the driving factors that make this such a horrible thing? Because these students that don't match, well, sometimes they go and do a year of research. Sometimes, there's other things, some kind of fellowship thing you can do, and then you reapply the next year. Your chances of matching when you reapply are less than the first time around. So just that's why the stakes are so high whenever you match that first round. Um, and it's not only that stress of finding that job after med school, but you're losing a year. You're losing a year of income of you already have this delayed gratification that medicine represents, where you're spending so many years in school and then so many more years of training that you're just delaying that another year. And it's and what kills me, and the reason I made that video yesterday and I published that video, is just because it's so hard to go on social media and see these unbelievably talented, brilliant med students uh, who are just devastated. And sometimes it's just because the match left them out. The algorithm didn't go their way. And it's hard to see, and it shouldn't be this way. And like I said, I think there's a lot of factors that are going into this. There's as far as the number of residency spots, a lot of people are talking about how the federal government, all these residency spots are subsidized by the government, and there's been a cap on the number of spots for years and years. Meanwhile, so there's the number of residency spots overall across all specialties in the U.S. are static, but there has been this huge growth of med schools, and there's been a lot of like for-profit med schools that are popping up, and so you're getting more and more med schools who are taking on new students, but the residency numbers are static, and that just doesn't make sense. Now, some people would say, counter that, be like, well, there's every year there's like 300 or so, there's a few hundred residency spots that go unfilled in the match. Usually, it's in like primary care, which there are just a lot more of those spots. They're considered less competitive to match to. So you're like, well, if there's all these open spots, and why? What's with that? And again, this is all so there's not just one easy answer to this, but I think the cost of education is a big part of it. When you have $300,000 to $400,000 in student loans at the end of med school, and you're sitting there trying to think, okay, well, what specialty do I want to go into? And in our country, in the U.S., specialty care, ophthalmology is another one. The medical field values that care over primary care, family medicine, pediatrics, internal medicine. It's less. It's just not as valued, and that it shouldn't be that way. That's the way it is in this country, and so you're saddling students with all this debt, and then telling them, hey, we have a shortage of primary care doctors. Why don't you go into primary care? And I think a lot of students are concerned that they're going to be able to, pay back all these loans before they retire. And so you can understand how when you have that much debt, you're going to be pushed to a higher paying specialty. If you go into internal medicine, you're going to say, oh, I could be a hospitalist. I like general internal medicine, but look, I can make a lot more money doing gastroenterology. And so you go and specialize, and you go and specialize, and you go and specialize. And so, I think a cost of education is a huge problem that drives a lot of this. And I don't know. I'm not an expert in any of this stuff, you guys. And I'm sure, if I'm way off base with some of this stuff, please, feel free to send me an angry email, or I don't know, or just talk about it in the comments here. I just, that's just what I think. And I don't know. I don't know why I feel like I have the authority to say this on here, but a lot of students are hurting right now, and I feel for them, and I wish I could do more to help them. Please reach out to people. Go on social media. There are so many examples of doctors who failed to match, and just find those people, talk with them, and get some perspective, and and learn from what they did and how they ended up matching the next year or finding a position. You can find a lot of insight and a lot of people who have gone through what you're going through. Okay, that's really what I'm going to say. So let's see how many people are kind of mad at me in the chat here. I think some of this stuff maybe is off base. Some of it is probably um, uh, some people hopefully feel the same way I do. But all right. So anyway, that's kind of the you hear a lot every year on the match time. You hear a lot of kind of drama around match, and that's, I don't know, that's some of it. All right. So I just went like 8 minutes without making any jokes. I'm sorry. I'm sorry about that. Thank you for sticking around. I still have this eight. This is still got a lot of people here. We got over 800 people here. Let's see. Greetings from Germany. Thank you. I appreciate it. Couples matching is also really hard. So some people will couples match. They meet each other. They fall in love in med school, a wonderful thing. And then you have to try to match at the same program. You can imagine how stressful that is. All of this is just insanely stressful. It really is. Do I have any ideas on how to fix primary care? I don't know. Again, I'm not, I really am not the person to ask I don't want to say things that are not true or that, I just don't want to speak out of turn. I feel like I'm already probably doing that a little bit. And I do know that the lack of primary care doctors is a problem. I wish I had a good reason or good ways of fixing that. I think, again, the cost of education, of medical education is extraordinary. It's so high. And it's saddling students with a lot of debt, and that's a big problem. God, lots of people from all over the world. Brazil, we got France and Luxembourg, Sweden. Hi everybody. Let's see, we got another little donation here. What's your question? So I can ask a question of a doc that isn't a specific ophthalmology, but a doctor. You know what? You guys can ask me questions about general, like, body medicine. I might not be able to answer it because you got to remember, I haven't done any kind of medicine like below the nasal bridge in about 8 years. It's been a minute. It really has. And so, like, for instance, like, I haven't thought about sodium in a while. I haven't thought about the ventricles. So I'm limited in my my general medical knowledge. So I apologize for that. And so you're not gonna get much out of me in terms of non ophthalmology knowledge. I did, to answer. So someone asked, did I match my first year? I did match. I was very fortunate to match. I applied to about 47 programs. I was a little nervous about it, but I was very fortunate that I did match. And the matches, it's, every specialty is a little bit different, and so, and whenever it's funny that you mentioned that, I'm an ophthalmologist, and that, whenever I post about match stuff, I do get angry comments from people saying, who are you to talk about the difficulties of this? You're in a competitive field. You're an ophthalmologist. You know what? I don't know. Like, who are we to, yeah, I don't have any firsthand knowledge of not matching. You're right. You're absolutely right. So my input on this is probably less valuable than someone who went through that. I do know that I have this platform. A lot of people listen and to what I have to say, and so I try to be very careful about what I say, and but I think a lot of people find comfort in some of the things that I can say, and so being able to give a voice to people that go through these very difficult things like not matching, I think provides more good than harm. And I hope I'm right. I'm going to assume that I'm right, and I do hear feedback of people that appreciate it. And so if I hear that from someone who's going through this and not matching or going through a difficult time, I'm gonna keep trying to help to the best of my ability. Madeline, Maine, do you ever wonder if primary care could get more matches if they get less overwhelmed by crazy patient to doctor ratio? Well, I mean, that just goes to the shortage, right? And uh, again, at this point, we're getting into like, how do we fix this? And I don't have a good answer for you. And for me, it really a big part of it again comes to the cost of education. You got to think that either providing scholarships for people going into primary care or just lowering tuition or capping tuition um, is going to help people make the decision to go into lower paying specialties, or just trying to reimburse primary care doctors for the services that they provide. Like, reimbursements continue to go down for medical services like across the board, but it shouldn't be for primary care. It should be going up because they do primary care doctors do a tremendous amount of work, and for the fact that they don't get paid as much for that work compared to a procedure based specialty, it seems a little bit backwards. It should be more of a level field. I really do think that. Thank you for the jokes. The cornea joke, the cornea the better. Yes, thank you. You know what? I've only heard that joke like roughly a million times. So I really do appreciate you, Gabe. You put yourself out there. Fantastic joke. All right, I love it. It will follow me to my dying day. I appreciate it, Gabe. Shoot your shot, Gabe. I was, you know what, totally worth the $5 if I do say so myself. All right, you guys, we got like 5 minutes left. I want to address a couple things. I want to talk about uh, Glockenflecken lore, because one of my favorite things is I put a video out that has some of these characters in it that like gives you a little snippet of their past life or their current life or their characteristics or whatever it is, and and then it's like canon now, right? It's like, so I'll give you an example. I mentioned in a comment that Jonathan was magical, that he has magical properties, and I do think that's true. I think I don't even know if I know what Jonathan is, or where he came. I know where he came from. I know where he can, and I will at some point get to a Jonathan origin story. I promise you, I will, and it will be fantastic. I promise you. But yeah, I do think he has some magical abilities. All right, and I don't think we've even seen the potential of what Jonathan can be, or what Jonathan can do. All right, so stay tuned, because the Jonathan story is not over. It is only beginning. Everybody. Zarina, my daughter has been going to a pediatric ophthalmologist for years, and I just want to say thank you. Yes. Oh, that's so nice. Thank you. I love what I do, and no matter how busy and crazy the social media thing gets, I will continue to practice medicine, continue to practice ophthalmology, because I love it, and it's just at this point, it's inseparable from what I do on this channel. Thank you for the note, Sarina. Kate Luck, you're a nurse, and 2 of the 4 hospitals have been worked for don't have any med students residents at all, only attendings. Seems like a wasted opportunity. Yeah, there's a lot that goes into starting residency programs. There's a lot of accreditation. You have to have certain numbers, certain specialties represented, certain numbers of doctors and support staff, and there's, and I'm not an expert in this because I'm in private practice. So, but I do know that there is a lot that goes into accrediting a residency program, because the last thing you'd want is to start a residency program and then not have the ability to educate them and train them properly. So there's a big part that goes into it. But even just like having residency programs and like adding more residents, because you always hear about residents being overworked, there's a rampant burnout. So you got to think that there's ways to increase the number of residency spots just to help out with the patient burden out there. Not that patients are a burden, but you know what I mean. The number of patients that need to be seen, that need care. Miss Canuck, I like your name. Hi. Hello to the tooth dental side of medicine. Hi from the eye dental side of medicine. Hi, good to see you. Thanks for being here. Thanks for being. So anyway, back to the lore. So yeah, Jonathan, I think he has magical properties. Also, I gave you a little nugget that we don't quite know how old the psychiatrist is. He is very old. People have conjectured that he might be immortal. Who's to say? No one knows yet. All right, stay tuned. But we know he is at least a number of years older than the neurologist. I got to say, I love that sometimes I'll put those little things in the videos and you guys just run with it. I love it. I love reading the comments. I really do. At least the nice ones. And so keep commenting. Give me your thoughts. Someone asked about a new character. So a trauma surgeon was born in my video. You guys saw that a couple videos ago. A trauma surgeon was born. So that will be probably an evolving character. We'll see where I go with that. Still working on an OBGYN. I know. I hear about it all the time. You guys want some OBGYN representation? I trust me. I know. I get it. It is a weak spot in all of my list of specialists at Glockenflecken General Hospital. As a man, I'm a little bit. It's a little bit outside my wheelhouse in terms of comedy, and so it's going to take some thought. And I want to make sure I'm respectful while also providing the funny. All right, and so just give me time. I'm figuring that out. All right, what kind of bro is endocrinology? Sugar bro. I like that, sugar bro. All right, a couple more minutes, then we'll wrap things up. Greetings from Brazil as primary care doctor working in family medicine. So happy to hear. Yes, and I'm not. It really is so important, I think, for everybody in medicine to support primary care because it's again the work that primary care doctors do in this country and everywhere in the world, like Fernando mentioned. It's they are undervalued, they are overworked, and you can see that in the family medicine doctor portrayal that I put in my videos. And so we all need to be supporting them and just talking them up because their job is hard. Most jobs in medicine are hard. Pretty much every job in medicine is hard, but they have a very special role in medicine in taking care of a wide variety of different problems across an patient's entire life. Very unique part of medicine and very important. All right, and David asked, "What is a scribe?" Family medicine. So a scribe is someone who does all my clinical tasks for me. So I will sit there and document on a patient, a patient's chart, or I'll talk to the patient. The scribe is documenting everything I'm saying. It allows me to look at the patient when I'm talking to them. It just helps me form a bond with my patients a lot easier. And they kind of do print forms and fill things out and bring patients into the room and sometimes do a little bit of the workup. Very, very helpful part of the healthcare team. And so I'm a big fan of scribes, and I do wish it was more widespread, the use of scribes, but it also speaks to kind of how we are as medicine now, that we have to have scribes, right? Because it is there's so much documentation that has to happen, especially with something as complex as an electronic medical record. Gone are the days when you just have a paper chart, you write down like three or four unintelligible, undecipherable words, and then you call it a day. That's gone. There's a lot of documenting that has to happen now. All right, Rebecca B, thank you for the love. You got fussed at by ortho. If ortho gets mad at you, just speak speak slowly, short sentences. Don't use anything more than 3 syllables. Okay, that'll help calm them down. Trust me on this. All right, and just as you're talking, just fit the word bone in there. Every so often, it'll diffuse the situation. Okay, all right, that's just my professional comedian advice. All right, guys, I'm going to wrap this up. Thank you so much for being here. And the last thing, because you put $5 in, Rosa, what inspired to be an ophthalmologist? I'm a weirdo, and I really like eyeballs. I love the anatomy. I love I just love the gadgets. I love the things that we're doing. Looking into the back of the eye is really really cool, really interesting. So it's really the anatomy, the physiology. I love all that stuff. So thanks again, you guys. I appreciate it. Thank you for being here and all the questions. And yeah, I'll try to do this again in a couple weeks. I wish you the best. All right, take care.